Okay, let's look at probing technique. First, I'm going to grab my mirror and establish a modified pen grasp, and then I'm going to get my probe and establish a modified pen grasp as well. I'm going to start in the maxillary arch, so you can see that my probe is pointing up towards the maxillary arch. I'm going to go ahead and retract. I'm starting in my dominant side, sextant 1 buccal. When I start in the posterior, it's a little harder to reach way back there, so I'm going to kind of come up on my grasp on the handle so I can use some length of my instrument. I'm also going to establish an extraoral fulcrum here. This just allows me to be able to reach those posterior molars a little bit easier. So for this demonstration, I'll start on tooth number 2, distal buccal. So I'm going to go ahead and insert at the distal buccal line angle. I'm going to insert until I feel that resistance from that junctional epithelium. Then I'm going to start walking the probe backwards. And then once I hit that distal contact, I'm going to tilt my probe out a little bit and then take a couple more steps and pivot a little so that I can reach that distal call. Then I'm going to come out, come back to the distal line angle, and I'm going to walk my probe along the buccal surfaces. And you can kind of see my hand is starting to move up because I'm pivoting so that I can keep the side of the tip of the probe adapted to the tooth. Now, when I reach the mesial, I'm going to tilt my instrument out towards the buccal just a little bit, take a couple more steps into that mesial call. So let me zoom in a little bit so we can take a closer look. So I'm going to go ahead and retract. We're at the distal buccal of number 3, and I'm going to ask my patient to look away a little bit and insert at the distal buccal line angle. I'm establishing a 15-degree angle here. I want to be careful that the angle of my probe isn't too great here. If my probe is hanging way out here, that's going to provide incorrect readings, also can be uncomfortable for our patient. So make sure that we're establishing that 15 degrees. So we want to stay adapted to that, the tooth surface, the root surface, and stay parallel to that long axis of the tooth. So start at the distal buccal line angle, walk backwards, hit that distal contact, tilt out a little bit, take a couple more steps. Now the tip of my probe is pointing towards the distal because I'm taking that distal reading. So whenever you think about kind of what direction do you need to direct your probe, think about the direction of the surface that you're working in, and you want to direct your probe towards that surface. So I'm going to come back out to the distal buccal line angle. I'm going to continue walking. I'm pivoting on my fulcrum so I can keep my tip of my probe adapted. And then I'm going to hit that mesial contact. I'm going to tip out a little bit, take a couple more steps to get that mesial reading. I'm going to continue probing in this manner until I reach the anterior. Now, the closer that I get to the midline, I can establish an intraoral fulcrum. So you guys can try this as well. So I'm going to palm my mirror and I'm going to retract with my index finger, and I'm going to establish a fulcrum close to my working area. So I'm at tooth number 6. I'm going to still start at that distal line angle, walk all the way to the distal, tilt out a little bit, take a couple more steps, come back out, distal line angle, across the facial. I'm pivoting, walking, pivoting, walking, and then reach that mesial line angle, tilt out, take a couple more steps. Now, once I reach 7, 8 area, then it starts to feel a little uncomfortable, so I need to switch clock position. So now I'm going to change the direction of the probe to go with the angle of the probe going towards the direction that I'm working towards. So now I can fulcrum here, go to the distal line angle, walk back to the distal, take a couple steps into the distal call, come back out, distal line angle, come across, pivoting on my fulcrum, hit that mesial, tilt out a little bit, take a couple more steps to get that mesial call reading. So you're going to continue this all the way, and you're going to establish the clock positions for the correct area of the mouth. Now I do want to give you an example of posterior mandibular probing. So let's see here. I'm going to retract. My patient is already looking away from me, so now you can see my probe is pointing down towards the mandible. I'm established a finger rest with my mirror. I'm going to come up on my fulcrum. I'm fulcruming on the anterior teeth, giving a little bit of length on my handle, so kind of scooting my grasp backwards, starting in that distal line angle, establishing that 15-degree angle, walking towards that distal, tilting out a little bit, take a couple more steps into the call. Now I'm going to come back out, distal line angle, come across the buccal, walk, 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 hit that mesial, tilt out a little bit, take a couple more steps. I'm going to continue that through to the anterior. I can give you an example here. I'm really high on my fulcrum now. You can see my fulcrum finger. I'm using the pad of my finger to establish that fulcrum. So I'm at tooth number 27, distal line angle, walk, 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 hit that distal contact, tilt out a little bit, take a couple more steps. Come back out, come across that facial, maintaining that 15-degree angle, tilt out a little bit, take a couple more steps for the mesial. So I'm going to continue that on all the way, utilizing the correct clock positions.